Hi, welcome to Southern Health Podcasts. This podcast is all about quality improvement programme at Southern Health. I spoke to Gemma Stubbington, who works with the community mental health team in Winchester, to talk to her about the impact QI had on their team. Hi Gemma, thanks for joining me. Do you want to just introduce yourself, please?
Gemma Stubbington, Band 8 Team Manager at Winchester CMHT.
So Gemma, you've recently been in touch with the quality improvement team. Tell me about that. What made you get in touch with them?
So we were chosen to be part of the pilot accreditation team to complete the pilot study, and I was brand new to post and figured out from the pilot accreditation there was a lot of things I didn't know. And so I started asking lots of questions to the staff who were running the peer accreditation, to ask them different things about what I didn't know and what I didn't understand. And they said, get in contact with Dean, who was also part of the pilot study, to help. I got chatting with him, asking him what QI actually was, because I really didn't know. I was brand new to post. I was like, what does this mean? I know I'm making quality improvements, but I don't understand how I say it's a quality improvement. I don't really understand how to judge what is a quality improvement, thinking it was something massive. But actually he started breaking it down and saying a tinker there and a change there is a quality improvement, but it's about really understanding what it is that you're doing and what you've done. Through further conversations, I let him know that I was running a team away day in December, and I wanted to split my day up into two, and I contacted Dean on the off chance and asked him if he would be interested in helping me with a team away day, and he said he loves team away days. And so we put some ideas across, but really I wanted to take from the culture and diversity questionnaire. There were some parts that we had a slightly lower score. So we focused on our worst score, which was concentration. And we broke down what the concentration problems were for the team, and we were able to reflect that our problems are one room works for everybody. It's very noisy, it's very busy, it's very cluttered, there wasn't enough headphones, people couldn't hear themselves, there was lots of shouting, talking loudly over the room. There was not a good flow of IT in the right place. We really broke down what the problems were, and then we grouped off quite a few times to think about how we can make changes, and then we set lots of targets for ourselves as a team to improve our environment. So it really helped us break it down and really troubleshoot and problem solve, and really an introduction to QI for the whole team. There'd been some people who knew about QI, but actually a lot of people we'd never had any speakers come about it. We'd never had any really good discussions about this is a quality improvement, but we've never named it before. And it got us talking about QI, and the biggest phrase we used from thereafter from meeting Dean was waste time. Which he loves to talk about. Yeah. And we quoted that many times in months to come. This is waste time, and really noting what it was. Yeah.
And so what difference do you think that made to your team?
From really breaking it down, everyone came away with such a buzz about what we needed to do, and we set targets of what we wanted to do in the environment. It gave everybody a real buzz that we can make changes. We don't have to just sit in an environment just because we're sitting there, and we can make changes and do things differently. I think it's led on to so many more questions about what we're doing in our practice and why we're doing it, and really learning that we can stop and pause and take a moment to consider what we're doing and question it and look to see if there's different ways of working. I think it gave everybody a newfound kind of responsibility to change.
But also probably a freedom to think they could have that impact on change, couldn't they? Sometimes with QI we often get people asking permission to make changes, but actually it's trying to empower staff to recognise the changes that they can make.
I think what What I'm trying to install, and I think we've totally got this, is we can write the rule book.
Mm-hmm.
It's okay. If we've got an idea, we can use it and bring it, and it's exciting, and that's come, I think, because a lot of us have been here for a long time, and I think we still feel quite fresh and energised. I think the changes is that we own this environment. We own so much. Yes, we're driven by policies and procedures, but actually, if we've got ideas, bring it to the table, embrace it, enjoy it. And people will sometimes say, I've got an idea, can I bring it? Of course you can. Enjoy it, embrace it.
And was that there before Dean went there, or was that kind of...
I think the questioning of things really improved from that session with Dean. And certainly he offered to spend more time with us, and to do a QI Olympics.
Yeah.
Which we haven't had the opportunity to do, but I'd love to bring that into another time that we have some breakout time for an away day and do a QI Olympics. I'm certainly going on the QI 3-hour session that he's been putting up on the Facebook page.
So that's the bite-sized sort of how to do QI,
Because I think what we're really good at doing is making changes, but sometimes we don't know necessarily exactly how to describe why we've made changes or what we're making changes for, and I'd really like to get it so that we can say, we are doing a quality improvement project, this is the reason why, because I think we need to get better at naming it to be able to promote it and to be able to kind of congratulate ourselves on something, but saying this is a quality improvement project.
And I guess with that comes the methodology where you kind of work out what's the current state, so what's the situation right now, what can we do to make changes to that, and they will introduce various tools along there like the PDSA cycle, plan, do, study, act, so that you can see the difference that something makes before you move on to the next one. And would you take QI further and use it within the way that you deliver services within CMHT? Because obviously it sounds like it was quite a staff-focused piece of work you've done here, but can you see the benefit in using it?
Absolutely, and I think it works really closely with the peer accreditation model, which is now called Aspire. I think that can really help you firstly understand exactly where you are as a team, but certainly for new managers or new team leaders, it gives a really good, and it invigorated us to thinking differently, way of learning possibly what you're not doing and bringing in kind of some best practice and some best practice ideas. And certainly for me, in terms of quality improvement, I think that we weren't involving service users, we weren't doing co-production prior to thinking about the Aspire programme and the quality improvement, and it's really improved our co-production here at the CMHT. I think co-production is a very much a new word, and I think for some people don't understand what that means. We know what service user managers and service user reps mean, but I think what we didn't know is what co-production meant and what co-production meant for us, and that's where we have looked at quality improvement with our service users as well.
And I guess co-production in mental health is quite tricky to get right, isn't it?
It is, yeah.
I think, So have they been able to give you any advice with that?
So what I've started is we've met for the first time at a listening event with service users, and the Aspire programme very much looks at quality improvement, and for us it was, let's start the process by listening, and so we've held one listening event, and we're due to hold our next listening event where we want to see what service users can help us learn and understand and what we can do differently as part of our quality improvements. John Rose, who's the service user manager in the Mid and North, very much worked with me on this to say there's no agenda. This is a listening meeting where we wanted to listen to difficulties that patients may have had, that have experienced a service. So there's a great example of one of our service users told us that a letter that they'd received, it had on the bottom that it had the whole care plan, and at the bottom of the letter it said, if and when you are discharged, re-referral will be back to by the GP. And this didn't make any sense at all, but I wouldn't have known about that if it hadn't been brought up at the listening event. So straight away when I came back, I asked everybody to remove that from the pro forma, because it was very confusing and not at all relevant for anyone that had it on the pro forma. So it's events like that can help us learn.
And that's your little tweak that makes the difference, that you can benefit from.
Yeah.
So
it doesn't have to have a massive, great big project. It can be quite simply that we're told that something's not right. We can see and totally agree it's not right.
Going back to that service user and telling them the impact that has had on them, we'll want them to be more involved the next time that things come.
Yeah. I'd never, as a band 6 nurse, I hadn't really looked into what is a quality improvement with the title. I'd always been keen to look at changes or differences that we could make, but never with the wording. And I think the wording has come up so much in recent years. And then I know it reduced during COVID for obvious reasons. And I think it's great to hear that the project's back and running again.
I think it's interesting to say about that during COVID, because actually I think quality improvement as a concept and continuous improving, and a lot of teams were forced to do what they now would probably know now as quality improvement by readjusting how can we carry on delivering our service in a way because of these new restrictions we've got in place. So, and I think there's lots of lessons to be learnt from the work they did then. They probably didn't realise they were doing it. So
I think that's right. Look at what
people were doing it quite naturally.
Yeah, I mean, we used to go to one of our private providers, a Priory, which is in Gosport, and we used to have to go there multiple times per month to have reviews and CPAs. And then COVID happened and everybody got better technology, and now we don't have to waste time travelling, and we can log on, hold a really good CPA. We've got great video resources. I've just purchased us an owl to improve our technology, because we've realised that this is here to stay, hybrid working, and actually it's also been fantastic to help reduce waste time.
What have you purchased? An owl?
Yeah, an owl, which is it's a fantastic camera and audio equipment.
Right.
Because we've got a big meeting room, and our speaker system is really poor, and so for hybrid working, which is here to stay, some of the staff couldn't hear very well when people were talking at the back of the room. It was a big expense, but hybrid working is here to stay, and I think it's really helped us being able to hold really good meetings that everyone can be heard clearly, and everyone's points of views can be heard properly.
And I'm just slightly off. What about service users during COVID, and how had you been able to manage to keep that going?
We were a service that opened and ran throughout COVID.
Yeah.
We continued face-to-face for all of our core business. So obviously we continued as a CMHT to administer depot injections, clozapine. When patients were in crisis, we were visiting them. We continued to be an open door service throughout the whole of COVID. We had many staff in base. We changed in different ways. We used scrubs where we'd never used uniforms before. It was the hardest time of our working careers, I think. But we were an open service throughout COVID.
Wow. So nothing went online or anything. You kept everything face to face.
We found that we could hold a nurse-led clinic online, either by video calling or by phone calls, and we also found that new patient assessments could somewhat be done online, video calls or telephone calls. There are a certain group of patients who needed to have face-to-face assessments, so they continued. We quickly found out what services could be run virtually and what services had to be run face-to-face. And staff had to learn very quickly how to set up video calls, Zoom calls. It was all a little bit difficult for a while.
I do remember, isn't it? Yeah.
But, it made us it taught us a lot.
And have you kept quite a lot of those ways of working since?
Yeah, we found out what we wanted to keep and what we didn't want to keep.
Yeah.
We wanted to really increase our back to work plans, so we've got a lot of staff obviously back in base, but actually we found now that there's opportunities there are some days that home working works well for various different reasons, for not having as many desks as we'd want to have, or for being time efficient. There are days where people can work at home, and that never happened beforehand.
No.
That choice wasn't there.
No,
especially
it wasn't even thought of really, was
No.
it? It wasn't even considered.
No.
But I guess technology enables that now, doesn't
Yeah,
it?
absolutely. And video calls for some patients who would like that. We've held groups over video links, and some groups have had better attendance at video than they had when it was face-to-face, through confidence and self-esteem and anxiety. So there are some things that have worked really well.
Thank you for joining us, Gemma. It's really interesting to talk to you about the benefit that QI has had on your team. If you'd like to hear more about QI, please visit the staff portal pages staff.southernhealth.nhs.uk/QI. Thank you for listening.